We're here at the CROI, the 2017 CROI, and we're very appreciative to have two great representatives of MSF, which is Médecins Sans Frontières, Doctors Without Borders. We have had in the past others that have presented on Ebola and other subjects, and we even had, I think, a pharmacist from 15 years ago that came out and talked to us and with us. So we appreciate it. Before we get started, I just want you to introduce yourselves. This is Tom and Leon, but tell us a little bit about the work that you do specifically.
Hi, thanks for having us. I'm Tom Elman. I'm a medical doctor based in South Africa in Cape Town, actually working with our first MSF section in Africa, the MSF Southern Africa group. And I run a medical unit called SAMO, which supports our global HIV, TB, and hepatitis programming.
Mm-hmm. And Leon?
Hi, my name is Leon. I'm the program manager for MSF based in Paris. I'm managing 7 countries, so it's 3 countries for HIV program, Kenya, Uganda, and Malawi, and 2 countries, Armenia and Georgia, for MDR-TB, so multi-drug resistant program, and 2 programs for migrants in France and in Greece. Mm-hmm. So I'm a medical doctor also.
Where does your funding for MSF come from? Is it mostly from governmental sources, or is it from donations, or collectively?
The vast majority is private individuals. We try to be as independent as possible from institutions. We don't accept funding, for example, from the US government. We don't accept
because of the strings that come with it, is that?
Well, that's one issue. I think it gives us much more freedom not to rely, but also perception. If we're trying to work in Afghanistan or parts of the world where there are Western interests, it's very difficult to be safe.
Understand.
And to give us operational space, we need to be seen as independent, and that really comes from funding.
Right. So it's very important to have those specifics handled.
Yeah.
So the work that MSF has been doing lately, can you tell more? I guess get a little more about what you've done and in your area of the world that you're working.
Okay, well, as I said, our unit is a medical unit, so we provide the backup support to our operations, and we support global operations. So we have HIV and TB programming, a very large amount in Southern Africa, which is why we're based there, but across Central and West Africa, where the epidemic is still, you know, we walk into hospitals, it's like 15, 20 years ago in parts of the world that are now providing treatment. We also support programming in India on hepatitis, on drug-resistant TB, in Ukraine with drug users and prisoners. And as Leon says, you're doing work with refugees as well around.
Yes.
So the work you do is hard from a standpoint of being able to facilitate the work in the first place, to get it, like you say, through the hoops and so forth. Do you have a large difficulty with the government, or is it the people, or is it with all of it, with getting them to agree to?
So the difficulties that I think that it's mostly with the countries, because we are working in the country, and majority of our projects, we are running the project with the Ministry of Health, and working with them in their facilities, so that we need to discuss with them at least to find the way of working together. We know already that in majority of our projects, the big issue for the government, it's just for the human resources, because we are working in the place that there is lack of human resources, and another difficulties is just for the drugs. So there are also shortages of drugs. So MSF, what we are doing, it's working with them and providing at least, in terms of human resources, and providing drugs at least for the patient, so that they can get quality care. So what we are also doing in our project is at least to develop model of care, because to cope with the lack of human resources in the countries. So it's this kind of project that we are providing in the country, developing the model of care, so that the people, they can get treatment in the countries.
We could say that we make things difficult for ourselves sometimes. Our way of working is to provide medical care on the one hand, for populations who have no access to it for various reasons, whether neglected populations or neglected diseases. But we also speak out. So one of the core elements of of MSF's work is témoignage, witnessing, and trying to bring about change. So we do research, medical research.
And that makes it difficult for you because of
It
those,
can do,
that
yeah.
stance.
Yeah,
That stance.
if we
yeah.
speak out against a government, as we've
Yeah.
done in many examples, where the government are obstructing or denying access to care for their population, or speak out against major donors who are not supporting the diseases that need or not providing enough, we certainly can make it difficult for ourselves.
But they must appreciate your genuine interest in the bottom line, which is getting the people served that are needful. That must resonate with some of the people. And I think the governments, I've met with some of the presidents of different countries in Africa and the health ministers at the conferences that have been had, and they seem on the surface to be really interested in getting the services, but I don't know, maybe you can tell me a different story. I don't know.
Many of them are. There's plenty of good people, good ministers, good doctors, but it's a balance, isn't it, between on the one hand working together with partners and developing an approach that's meaningful and sustainable, but on the other hand calling things out when there's unacceptable denial of care. And we find treading that line is one of the things MSF's developed a lot of experience in over the years.
But are all of you in that vein of activism, so to speak, or is it just certain people that have to do that? Because I imagine it's a little bit of a dance. You have to go as far as you can without cutting off your nose to spite your face, so to speak.
Yeah, there's a healthy tension,
Yeah,
I think,
tension,
between
yeah.
the conservatives in the organisation.
Yes.
Yeah.
But yeah, I think the spirit of MSF is activist, no question.
Yeah, I think that it's part of what we are doing. It's our job also. It's making the témoignage of what we have done in the countries. And yes, it's just making the balance between providing care and also making the témoignage, because it's not easier. Even though we are saying that, okay, the Minister of Health are open, but sometimes they can be also tough with us. And we need at least to talk.
You can also play good cop, bad cop. We have different MSF sections. There are 5. The Paris section, the Dutch section, the Belgian section, and we're all family, but there are differences of opinion and there's independence. So sometimes you'll find one organisation speaks out very, very loudly, gets kicked out of a country. Another another of the sections a bit more quiet and keeps going with it.
You do what you have to do to get the job done.
Yeah.
Where do you work in almost all the countries or continents around the world, or do you just pick out the areas that are at greatest need, or what you have resources for, I imagine? Is that the case?
So currently we are working in more than 100 countries.
Yeah, we're not in Antarctica.
Yes. So majority of them are in Africa, and now we are in the Middle East, according to the current situation.
Yeah.
And some project also in South America.
Right.
And in Asia also, Cambodia.
many.
And, so many of our projects based on the need. It's based on the need, can be the conflict or can be also the health situation that bring MSF at least to develop the program. Currently we are working in Armenia and Georgia. We can say that it's not like in Africa, but our project, TB project, based on the new drug that is coming in for MDR TB. And now we are struggling with the company because the drugs is not available for the patient. So we are also developing this kind of project, at least to show up that, okay, there is a need, and the people, they are looking for the drugs, and the drugs, even though it's available, but it's too expensive, and we need at least to do the project and to show up that, okay, we need to work, the people, they need drugs, and the price need to be reduced. So this kind of project also we can develop in some countries at least to show up that, okay, there is a need, and we need to work at least to reduce the price and to do everything. So our project is based on the need and the situation in the countries.
You must,
so we are not in all the countries in the world.
Right. You're not in the United States yet. I think if things get bad
It's
enough
been discussed.
administratively,
It was
may well
being
happen.
discussed
May well
in the
be
past.
needed one day.
that could be a bad situation if we have to call on you guys to help out.
Yeah.
Yeah,
But
I know that it was discussed in the past, at least to develop the program for Chagas in US, but it's something that we still discuss. Today we have a program in Paris for the migrants,
Really?
and we have
Wow.
also the program in Greece.
Yeah.
So we can say that, okay, there is a need also, and
That's
we
a
can
bit of a
develop.
slap in the face, isn't it?
Yeah, yes, so that we
Yeah.
can develop some program.
Do you have
even in the
partners
country.
that you work with to help you in ways? I mean, how many people do you organization do you partner with to get to the, to resolve your issues that you have to deal with? I mean, you already have different
Yeah, I mean, I think
sections of your organization.
hundreds of partners. Every
Yeah.
project will have its partners. In some countries, if we're in Central African Republic or in South Sudan, you're in a desert. There's no healthcare, and you may be absolutely alone working with the local community. And our engagement with local communities is our greatest strength in terms of a partnership where there's no one else. But in Europe, we're working closely with all the multiple small civil society actors and activist groups around the refugee crisis, and globally, I would say in every country we have our local partners and our international partners, and always trying to work with the ministries of health.
Oh, there you go. And it seems like there's always an opportunity for those who are watching that are seeing an opportunity for them to participate with you. They know easily enough to find you. An office in New York, and
I got to do the plug. MSF.org.
Okay,
there's many websites, but you look on there, you'll find everything. And we need people working.
People
with us.
as well, and people is a good resource.
Yes.
And the right people are willing to contribute their time, I imagine, too, in various countries as well as our country.
Oh, definitely.
Definitely, we need people at least to run the project, so that we need people,
Well,
medical people, and other people also.
You go where no one else wants to go. With Ebola, you've been there, and like you were saying, it's if you'd have to bend on you guys solely for something like that, it becomes very difficult. So we need people who are altruistic to jump in and take.
Yeah, but also just to support advocacy efforts. There's unprecedented threats to funding in the US and elsewhere on HIV, to support for refugees, humanitarian crises around the world. The world is closing off.
You got it.
And for people to engage with us and with other organizations on fighting back.
We wish you guys so well, because it is such a valuable organization. It's got to prosper, it's got to move, it's got to be active all the time, and we got to have more people to it. So we wish you well for that.
Okay.
Thank you
Thanks
very much, Tom.
Thank you.
Thank you.